but the people who are attending his lecture first time through IIMAD website. And Professor K. Srinivasan was formerly the director of the International Institute for Population Sciences, Mumbai. And in fact, I did my PhD there, not just a PhD there, I did PhD under Professor K. Srinivasan. He was my, probably my guide, my friend, and, in fact, I can also call him Godfather. And in fact, I met him first in 1982 to attend an interview for the certificate course in demography before I got my master's in economics from Madurai. There was a train ticket was free. So I took a first time train from Chennai to Mumbai. I reached there and I went to IIPS. I did the interview and he was sharing the interview for selecting the certificate course students. So that is the rest is history for me. 82 to now, and I know him close to 40 plus years. So it's a long relationships I have. In fact, some of my students got PhD. So he's now maybe not even grandfather, great grandfather of, my students and my other students coming up. My students are getting a PhD now. I can see that. And he's also an important person influencing policy making in the country because he was the one behind this, what you call them, delimitation being discussed now in this country. And he was the one asked the government of India to hold that delimitation for some time, like postponing that till to 2026. I think he played a very, very major role. In fact, everybody asking now, who will do that this time? I don't know. Somebody can, with that type of situation, like Srinivasan, who can influence the government. He could influence the government policymaker to postpone it. I think we don't know what is going to happen, but he influenced the policy of this whole country. And finally, he's also one of the person received the IUSSP Laureate for 2023, a rare for a demography community, and he was the first one to receive from India. So he has a lot of things you can read about him. He has written several books, several articles, and his bio was recently out by his daughter, Bhatma Srinivasan, who is attending, and you can look at his bio. And I think he's a well-known person. And I talked to him, can you speak this time? He has agreed. And today the debate is everybody talking about fertility. And not high fertility. They are talking about low fertility, how low it can go. I think that is something people are talking about. In fact, recently I was with the Chief Minister of Andhra Pradesh. He was asking me, can you advise me how to increase fertility rates? And he told me a joke. When the fertility was 4, I was the Chief Minister of Andhra Pradesh. I told the couples, have 2. Everybody listened to me, they had 2 children. Now I'm telling them, have 4. I told you, they will not listen to you now. Earlier they listened to you, they brought 4 to do, but you tell them produce 4, they may not do. I told you, you will be wrong to do that. So I think that context he is going to talk about the low fertility, and he worked on fertility NRR1. So with these few words, I am requesting Professor K. Srinivasan to give this talk. It will be followed by moderated by Professor P.S. Nair, who is a known demographer. He is one of the board member of the IIMAD. He will be moderating the session. And then we have a vote of thanks by Dr. Sunitha. And Nair, you want to say a few words? Yeah, one word, yeah. No, you open your...
Yeah. I just want to add 1 or 2 words of what you said, and you have told a lot about Professor Srinivasan. I also agree with you. He's the doyen of Indian demography now, and he's the most, as you said, he's the most senior person in India, and internationally also, he was highly respected, and one of the indications for that was the award of IUSSP Laureate last year. And then one word about his experience in fertility. I think Professor Srinivasan was born at a time when fertility was very high in India. Maybe total fertility rate of 5 or 6 at that time. Then he saw through and the declining fertility, and for the declining fertility in India, he played a very, very, very important role as a policy influencer actually in India. And now he has come, and he was an exponent of fertility planning or family plans, the so-called family planning in India for a long time, starting from the Gandhigram experience, then Bangalore, and then Bombay, and then internationally also. And now he's going to talk about, in my opinion, on a very difficult theme in the sense, reversing the low fertility or the replacement fertility, even though some countries have succeeded marginally, yes, but so he is the right person to listen on this topic, So I also welcome you, sir, for this important, important talk. Thank you.
Thank you.
Well, thank you, Rajan and Dr. Nair, for your kind remarks and also warm feelings expressed towards me. It's my pleasure to have known both of you for many decades and continue to interact with you. I think, today's discussions, I will tell you my views on the topic. I have seen the whole demographic transition in India and many other countries in my lifetime. From high fertility, high mortality, to mortality declining, fertility remaining high, then fertility declining, and then fertility going below replacement level. But let me share some feelings with you why in India this is not an important problem at this stage. Let me tell you. Well, the United Nations declared in 1985, 11th of July would be celebrated every year as the World Population Day. Since it was projected by the organization that the world's population will cross the 5 billion mark on that day in 1985. At that time, I happened to be the director of the International Institute for Population Sciences at Mumbai and celebrated the World Population Day in a grand manner. Rajan was there at that time with the inauguration of India's population clock installed outside the gates of IIPS. We had a very good programmer at that time, and I forget his name, Gunashekaran or Karthik. We set up a clock. We set up a clock also at Nirman Bhavan. At that time, Sanjay Gandhi was alive. Well, India's population at that time, in 1985, was 741.6 million. This was 14.82% of the world's population of 5 billion at that time. 40 years later, now, as on 11th July 2025, when we are observing another World Population Day, the global population is 8,231 million, according to World Population Prospects. And India's population, as estimated officially by the Registrar General, is 1415 million, which is 17.19% of the world's population. Please absorb the facts. That India's share of the world's population has gone up by 2.4 percentage points during the past 40 years. We have increased our share. We have not only retained our place in the global population ranking, but improved our share in the world's population. Item number one, keep it in your mind. Every year, the UN gives a theme for discussion and debate with regard to the population for the World Population Day. The theme this year, which was given to me, I don't know, you might be knowing, is empowering young people to create the families they want in a fair and hopeful world. Very fantastic idea. This is quite ambitious. However, the introductory paragraph of the statement given by the UNFPA for this World Population Day sounds quite alarming, as the paragraph reads like this by the UNFPA. As fertility rates across the world drops to record low, politicians and media pundits are increasingly sounding alarm bells, often sowing panic about terming as depopulation, population collapse, and even human extinction. I think the media can play havoc in this world. All this is sounded in the context of a world crossing 8.2 billion mark and India crossing 1.4 billion mark. See, our population is highest. They are talking of a human extinction. It's ridiculous. When one thinks about it, this is quite the opposite from the nature of alarms raised some 40 years ago. I was a witness to that. About overpopulation, exceeding the Earth's carrying capacity, and food scarcity, and other social and economic problems as a result of the world's rapid growing population. Malthusian fears of large-scale deaths due to famines, floods, epidemics because of population growth surpassing the food production dominate our minds. You should all read it also. The publications of the Club of Rome and the Limits to Growth by MIT scholars. They have developed a huge model in the 60s and 70s, sounded similar alarming bells as the pundits say now, of starvation, deaths at that time, and millions of people being wiped out by famines and floods 40 years back. Now we are alarmed of exactly the opposite scene of depopulation and extinction. During the 40-year period, let us look at facts. 1985 to 2025, the expectation of life for Indians has increased from 50 years to 69.4 years. Among the states in India, even the poorest states, Bihar and Uttar Pradesh, have achieved an expectation of life of 71 and 67 years respectively. The best performing states, Kerala and Tamil Nadu, have expectation of life 74 and 71 years respectively. The expectation of life is increasing more rapidly in the poorer states in India and catching up with the more economically developed states. So, in 40 years we have developed. With respect to fertility, in 2025, India has achieved a TFR of 1.9 children per woman, and Bihar and Uttar Pradesh at 2.92 and 2.28 per woman respectively. Kerala and Tamil Nadu have TFRs of 1.79 and 1.54 respectively. Kerala, with a higher expectation of life, has a higher TFR compared to Tamil Nadu, which has slightly lower expectation of life but lower TFR. Tamil Nadu has got the lowest TFR in the country now. The decline in fertility during the past 40 years in India has been achieved, as Irudayarajan and Nair said, by aggressive family planning efforts, of which I am also a part, with incentives and disincentives emphasizing on female sterilization. The present Chief Minister of Andhra Pradesh, Chandrababu Naidu, was a pioneer in promoting female sterilization in Andhra Pradesh, giving incentives even for one child at the time. For every woman sterilized, incentives were given to her, to the doctor carrying out the sterilization, to the institution conducting sterilization, and to the state government by the central government. This sterilization program was worked out with the collective force of central and state funds, with incentive money awarded to the woman, even with one child. In Andhra Pradesh, now Rajan is advising Andhra Pradesh. However, in spite of general improvements in the expectation of life across the country in all the states as mentioned above, this is another important point. The health of children below 6 years of age is still extremely poor, with 13.7% of Indian children undernourished. This is according to NFHS 5. 35.5%, one of the highest, of children stunted. Stunted means poorer height or age. 18.7 children wasted, low weight for age. Child mortality rate in India is 29 per 1,000 births. The Global Hunger Index in 2024 report indicates that India scores 27.3, considered as serious, and ranks 105 among 127 countries. We are only better than the politically unstable Pakistan, war-torn countries of Afghanistan and Syria, and some extremely impoverished countries in Africa. Apparently, our neighbors, Nepal, Sri Lanka, and Bangladesh, have better conditions relating to children's health. Please absorb this. And nutrition than India. This should be the cause of our alarm rather than low fertility. Thus, our priority should be to improve the nutritional and health status of children already born, rather than trying to promote increase in fertility levels. You want again more and more of malnourished children in this country? Some of the southern states, such as Andhra Pradesh and Tamil Nadu, have announced the plans to give incentives to mothers to have more children. It seems so ridiculous that we give incentives for sterilization on the one side, a permanent method to prevent pregnancy, and at the same time incentives for promoting additional pregnancies. Don't you think we are contradicting ourselves? The same government which gives money for sterilization is trying to give money for promoting additional births when so many children born already are malnourished, stunted, and wasted. The desire for additional child continues still to be quite low in the Indian states. The women don't want. Even in Kerala, with low fertility, 12.5% of the women in reproductive ages do not want any more children. Why? Because they want to give for the children already born better education, better health, better employment opportunity, and see them want to flourish. They just don't want to have many children, malnourished, hungry. In Tamil Nadu, it is 7.5% in Bihar. In Bihar and Uttar Pradesh, the percentages are 13.6 and 12%. Don't want any more children. Thus, couples themselves, even with the few children, one or two, do not want additional children because they want to give better education, better health, and career opportunities for children already born. Studies from low fertility in other parts of the world also observe these to be some of the reasons why couples there also do not want large families. My message and plea on this year's World Population Day is that these aspirations of parents and potential parents and further improvements in child health outcomes should be the focus and priority of governmental programs, rather than how to get people to have more children and giving incentives to reverse the declining trends in fertility. First and foremost, if you mean what you say, incentives to sterilization in the low fertility states, especially the southern states and a few others in the north, be stopped forthwith, and the money saved be spent in the improvement of the nutritional status of children. Thank you very much. I will leave you all with this message.
Thank you very much, Professor Srinivasan. I think that one message is very, very clear, that we should not worry too much about right now on fertility, because we are number one in the world and our proportion is correct. And but we should worry about the children already born, them, give them good health, give them good education. I just wanted to add one point. Probably we should also look at it other side, is that infertility in India is going up. As per some data indicate, 1 out of 10 couples have problem in having children at all, compared to the earlier, because of the late age at marriage. What government can do, because as long as government want to reduce fertility, they also should help the couples who want to have at least one child. They are not able to have. It is in the private hands now. All the low fertility, people have no children. They are running post to pillar to the private. It is not regularized. It's a big money to have baby with all other things. So as much as they want to increase fertility, forget about that. But at least they should help the couples who want to have at least one child. If there is money involved, government should come in a big way. I think we will open it up for discussion, Professor Srinivasan. I think now the Professor Nair will coordinate this meeting. Professor Nair, you go ahead now. Yeah.
Yes. Come on, let us invite questions from the audience, because there's a fairly good audience here, and now about 53 people are there. Come on. And I will advise you to be very brief, and the question should be to the point. Okay, please.
You can raise your hands or you can open. Yeah, please. Padma, you can go ahead. You can look at it there. She raised your hands. Padma, please go ahead.
Yes, thank you very much for this very enlightening, I think, talk, and also having an opportunity to listen to other well-known demographers, Dr. IRUDAYARAJAN and Dr. P.S. Nair. I just wanted to raise a point. What Professor Irudaya talked about, infertility, addressing infertility issues, or enabling couples who want to have children but can't have children. That's one part of the issue. The other is, of course, those who don't want more children should be allowed to stop their future pregnancies or whatever. So the government really has to think about policies, two different types of policies, enabling people who want to have children but can't children and helping them to have that, to realize their family goals. And the other side is, just allowing people who don't want to have more children not have children, instead of coaxing them or pushing them to have more and more children, by providing incentives for large families and so on. Now, the second one, providing incentives for large families, not going to work, because studies around the world have shown that women themselves do not do not want to bear the burden of large families, because it's most of the time it's the women who bear the burdens. And so once they're educated, once they have other opportunities, they don't want to have more children. So providing these incentives, it seems, I think, doomed for failure as such. But definitely, yes, those who want to have children and cannot have children, they should be, in a way, government should think about providing help for them, maybe some kind of governmental help for IVF treatments or some sort of treatments, and that would be good. In the end, if you look at it, it's about enabling couples to have the children, number of children that they want, basically, and not the government shouldn't interfere in this family formation thing. By all these incentives and other kinds of programs to influence the fertility trends in any way. That's my point. Thank you.
Padma, could you please open up the video?
Oh, sure. 1 minute. I have to get to the light, so I'm sorry. Okay, because I'm holding a cell phone. Yes, can you see me?
Yes, I can see you.
Nice to see you. I'm sorry, I should have, but I didn't have much lighting, so now I'm standing near the balcony.
No, the light is. I think the light is okay. I think so. Okay. I'm seeing you after a long time.
Yes, absolutely. Nice to see you again.
But Padma, you can also introduce yourself so that people know who you are and what you are.
Oh, yeah. Yeah, I'm also a trained demographer. I'm working as an independent consultant, a demographer, and that's what I can say. Otherwise, yeah, that's about it. Thank you.
Please open up. I think we have 50 plus people. So any question, if you will not get an opportunity to ask question to Professor Srinivasan. Any question, any clarification, or you have any other viewpoint, or you are supporting the viewpoint with some other databases? Yes, we have another 30 minutes left for us. Other than I ask question, yeah.
I have a question to Professor Srinivasan. To manage these questions and your reply, shall we reserve your reply towards the end?
Till the end.
Okay, thank you. Now you can. Now others can go for your questions. Okay.
This is the issue in the online. People will not ask question. Offline, we can call by names. Any one of you people in the thing, otherwise it will be talk between me and Srinivasan and B.S. Nair. So we want more people to talk. Irsat, would you like to ask some question based on that? What will be the implication of low fertility? Irsat?
No, sir, I think.
Okay. Any other people?
Can I add one more thing?
Yes, nobody's asking, you can ask. And add one.
Yes. I just wanted to mention one more thing in the presentation by Professor Srinivasan. He talks about stunting and all that. But I think, and even more far-reaching consequences of all those, very dismal child indicators is that about the future prospects of these children in terms of their school performance, academic performance, in terms of their employability and so forth. I think that's going to have a tremendous impact on the economy of the nation. So unless the child indicators are strengthened and enormously, I think this would have even if we have population momentum and all that, I think there will be far more problematic situations or issues in society than just the numbers of young people in society. So I really think, the focus should be on improving the quality of the population per se. Thank you.
Yeah, someone had a question, Professor Srinivasan, written down there. I have a question. How do you see the nexus between fertility and national security? I don't know, national security. So I don't know how any link there, but if you want to answer when you respond in the end, you can do that. This is by Dr. Murugan Yadav.
You want me to respond to that?
Maybe you can respond because there are very few questions. Professor Nair, can you ask?
If there are other questions, we can pool all the questions and answer.
So may I? I'm Sajini from Population Research Center, Kerala, sir.
Yeah, please.
Sir, in fact, we are working today.
Yeah. Everybody's working.
Sir,
Open up your video.
we are in the PRC and we are working.
Sajini,
Sir, can you hear me, sir?
yeah, could you please open the video? They are not seeing you.
Sir, it might disturb like my connection is, I'm from the university. So
Yeah.
I don't know if it will. Okay, sir.
Now,
I just
now-
switch off because I just want to be audible because I'm from the university, talking from the university. Sir, actually, thank you, sir. It's great to hear anything from such a veteran demographer and our guru, Srinivasan sir, and before you all, Rajan sir. I try to attend all the seminars because it's all informative every time he presents. Sir, actually, tomorrow I was preparing today for a talk tomorrow at the Directorate of Health Services because they have invited me to talk on the theme. And what I understand is that today this year's World Population theme has come up from the UNFPA State of World Population report on the real fertility crisis itself. And I came across Rajan sir's APW commentary, which says India's fertility journey has moved from crisis to choice. Very right, sir. And when we go to the report, we see the voice of the people of India saying that the choice is more important and why they are unable to achieve the fertility of their choice. And sitting in Kerala and hearing our youngsters and talking about the youth and discussing about the youth problems, we are actually hearing the voice that we hear from the neighborhood itself, that because of the health reasons, because of the cost of living, because of the social issues and financial problems, they are not able to achieve the number of children they actually want. And what we see is that our youth are not even ready for marriage because of the real pressure they are facing from our unemployment is a problem. They are migrating and they're setting up a family. And even my friend was talking yesterday about her own child. Both are doctors, and they are, even if they want a second child, they are not able to because there is no one to support in bringing up the child. So this report is very important, and they are really the voice of the youth coming up. This is just I want to say, and I've been following Rajan sir's commentary. Really, it's a summary of that report that has come up, sir. I just wanted to say this. Thank you, sir.
Come on, any other questions? I have a comment on Dr. Srinivasan's very, very thoughtful and very important observation that, the people we have to look at the whole issue in a very broad perspective. That is, when we think about fertility, the TFR, the number alone is not enough. Actually, we have to, as you said, we have to look into the quality of population, especially the child quality. When we often forget that, a country like India and and the developing countries, the quality of children, that is one of the main things to be looked upon by the policymakers, and and the problem is there even in states like Tamil Nadu, Kerala, etc., where fertility is below replacement. That is very important. That is a very good piece, in my opinion. Instead of trying to increase the TFR, and but we have to focus more on increasing the quality of children. That is the point I wanted to say. It's a very important observation you made. Thank you.
And Professor Nair and Professor Srinivasan, now that we are in the low fertility regime, as you have seen the high fertility regime in 40 years back, now we are the low fertility regime. We call them the regime. Now the society also completely changes. Like, in China, they talk about 1 + 2 + 4. Now there are families with a large number of elderly persons. And I think the time has to come not to talk about low fertility, probably talk about the implications of low fertility for the economy and society. If I'm sitting in Kerala with a million houses are locked in Kerala because everybody is migrating, and you also see a lot of families, the elderly are living alone. I have seen at least 5% household in Kerala, only one elderly person living alone, a male or female. And then there are 12%, there is only 2 couples. Both of them are old, 85 and 80, both of them living together. So the society is changing. This is also not noted by people. Because we only talk about fertility because population includes everything. Because you allow the people to live longer. Because on average, Keralites can live now 20 to 25 years after reaching 60. But what are the policies, program we can make their life, much more qualitative? We are adding years to them, but are we adding life to those years? The extra years given to people, 85, 90, 25. Are they getting proper care? Are they getting proper medical treatment? Are they getting proper economic security? Are they getting meals? We are talking about food insecurity among older persons, even starvation among some of the older persons because they don't have anybody to cook food. And, they have to order food. They are digitally illiterate. So I think those are the issues also should be part of the population program, not just one side. Fertility is only one part of your age pyramid, 0 to 4, 0 to 15. You look at the age pyramid, when Professor Srinivasan was talking to us in 1982, say 81 age pyramid and 2021 age pyramid, it looks very different. Am I right? So we are supposed to plan for the people. For the people includes young, old, adult age, education, skills. So you have to plan for the people. People now include, there are more older persons. We have close to 40 million older persons. And that is more than many countries' total population. Right? So I think we should also probably look at that. It's something we can link to the low fertility, cutting money for family planning, as Srinivasan rightly says. In fact, I told even one point in the government of Kerala that you close the family planning department. And you enhance the schools. Primary schools are being closed. So convert them into the daycare center where the older people can come and spend some time, read newspaper. Anyway, you are closing schools. 900 schools will be closed in the next 10, 15 years in Kerala because there are no children anyway. So I think you can convert them into social security policies, provide more pensions. Today, Kerala give widow pension. It is everybody's same money. Somebody is 80 plus widows, you can give them more. If they are lived up to 80 plus, then they may need more expenditure for health. So you don't need to have the same pension after 60, say 1,000 rupees. You can get 60, you lived 1,000 rupees. If you are lived up to 70 plus, you will give 2,000 rupees. 80 plus, you will get 3,000 rupees. This widow pension, old age pension. And if you are 90 plus, we'll give you 4,000 rupees. I think those type of incentives should be given because they are living longer. I have seen in medical colleges in Kerala, people are coming and trying to buy a medicine. They'll give the slip to the medical store, and the medical store fellow will tell them this is 200 rupees. That people say, sorry, we have no money. They go back. or gives one tablet. They might have to take two tablets, they take only one tablet, they go. They are not completing the course of the medicine. So there are problems with, as Prof. Srinivasan rightly say about the children problem, they also have the other end problem in maintaining their life. Especially older person, the context of children are living below poverty line. Children cannot support, not like the Professor Calver's theory of the wealth flow theory from children to parents. Yeah, children is poor, what they can do. So I think it's going to be a very tremendous task for the society to really manage low fertility with high proportion of elderly persons, like what's happening in China and Japan. I'll stop here. Maybe we'll give Srinivasan maybe 5 to 7 minutes, and then probably we can wind up. There is no questions.
Rajan,
Yeah.
one last question to me, because we have discussed the other issues like child quality, population quality, and aging, etc. Anyway, coming back to our theme, can we what do you think, Dr. Srinivasan, can we reverse the low fertility? Because I'm thinking of 2-3 examples. Singapore, I have heard long ago. They had in the beginning, in the 70s, etc., etc. There was a very intensive family planning or control program. Before that, because of that, they have reduced the fertility rate, and then they experienced the problem of, mainly the problem of shortage of labor force, etc. Then the government started giving all types of incentives to increase the fertility, but they failed. Okay, another example is recently, in Europe also, fertility started. Most of the countries were not having below replacement fertility, but recently France experienced a slight increase in fertility rate (TFR), but that is only very marginal. So it is China. I don't know what is happening now, because of they also have reversed so that they want to increase the fertility. But I don't know. What do you think, Dr. Srinivasan? Is there a scope, if at all, leaving the other aspects for the time being, and we can, if at all, we can increase the the lower fertility to a little higher level? Will it be possible? Because one thing, in Kerala, what I feel is now, for example, Kerala example, and many countries example is, once the fertility comes to below replacement fertility or replacement fertility, along with that, a social norm is also evolved. Is the social norm in the sense, the society thinks, the low fertility is good, the low fertility is right, etc., etc. It is very difficult to change that social norm, easily. That is my feeling, Dr. What do you think, Dr. Srinivasan, about this?
Yeah, before Srinivasan opens up his final comments, I just wanted to add to that. One is that the low fertility, because I was looking at the Andhra Pradesh very closely recently for the Andhra Pradesh discussion. I think I partly agree with the Professor Srinivasan that children want to be given proper food, health. I think I am with you. The point I wanted to add is that, probably personally, I feel, it is my very pure personal opinion. Yes, we are all talking about the data produced by the sample registration system. According to me, I believe, and I still believe, because I was looking at the CRS data in Kerala. CRS data in Kerala is showing TFR is not even 1.4, it is close to 2. So, the CRS is showing increase in birth rate. SRS is showing decline in birth rate. So I was telling SRS is deteriorating and CRS is improving. So CRS fertility is actually the correct fertility in Kerala, because all birth in Kerala is resisted. This is what I told to Andhra Pradesh Chief Minister. Look here, don't trust the CRS. You look for your own data, because SRS sample is very, very poor, inadequate, and the stops related things, the data is not really adequate for the low fertility states. Because when you had IMR of 160 in Kerala, okay, but now IMR is 10, 12, there is a problem with the sampling frame itself. People should look at it. So one is that, are we rightly having the right fertility at that 1.5, 1.5? I think that is something we should look at it. The second point, what I said, and Padma also, little bit added to that, is that providing chance to couples who have no children. I think I told the government, you cannot only say I'll give money to reduce fertility, but you should also give couples who have no fertility. You bring them into the family planning program, bring them to the insurance. Somebody wants to have a baby, insurance is costing 5 lakhs. Can we bring it to the insurance policies where fertility disease and somebody has no children? So if you allow the couples who have no children, you can help them. Second, infant mortality rate is extremely high, like Andhra Pradesh, 25. I said you should, when the children born, you are talking about future children to be born. Children born to be made survival. I told him Singapore is IMR is 3, your IMR is 25. When he called the health secretary, Rajan is saying is correct, 25. He said, sir, this is what SRS says. I said, SRS is wrong. How can he have a SRS of 25 IMR with 1.4, 1.5? That is some confusion with the database we are talking about. I think right time for us to even look at the data. Are we talking the right fertility trends in our country? Because the bigger states may not be a problem for SRS, like UP, Rajasthan. But the fertility declines sharply. You have to increase the sample size to produce a reliable fertility rates, SRS, which is not doing. Even like the Kerala Migration Survey, we started with Sakaria in 1998, we did 10,000 households survey. And before the last survey asked him, when he was alive, what I should do? He said, increase the sample. So we increased the sample size to 20,000 households in Kerala, the last survey. This is the highest survey conducted after Kerala became an independent state. So the sampling, the number is important because you have less fertility and you have less infant mortality rate. What you will get here? You have to enlarge the sample, which they are not doing. They have no money. One size fits for all. Sitting in Delhi and giving the sample size for all the states. I'm sorry that we should look at it. The SRS data's actual fertility rate, I think it needs some type of re-questioning on the database itself. I would like to add this if Srinivasan has any comments on that. And we will go to Srinivasan for comments for maybe 5 to 7 minutes or 10 minutes, and we'll go for the comments. Srinivasan, yes.
Yes. I think there are many questions of diverse nature. One is on extreme quality of data. The other is giving support for childless couples to have a child. On the other hand, the policies to increase fertility. But I feel 3, 4 things. One is you have to have healthy population. Healthy population. With this type of so much of malnourishment among children, as Padma was telling, our future population is also going to be quite below par population, both in terms of mental achievements and physical growth. So take care of the children already born before you draw policies for preventing things. See, this is the crux of my message, If Irudayarajan can publicize it, take care of the children already born, rather than planning. Second thing is, I think with regard to quality of data, I agree totally that SRS should be closed. I told about 5 years back, because if you keep on SRS, not only it will retard the progress of CRS. Now it has come to that state. And for Kerala, Tamil Nadu, there is data available in birth and death online now for the last year. I computed there, perfect. There is no need for SRS data. They confuse the situation. So my own feeling is, if for all those states which are considered relatively more developed, where CRS is close to 100% or even 95%, SRS should be closed. And these funds saved will be given, I have written about it, to the medical personnel and to the people who register the births and deaths on cause of death identification and, training how to register in time and quality of registration. So everything has a time to start and time to go. In government programs, what you do is, if you start a program, it is difficult to close it because there are so many vested interests coming. SRS, that the RG was telling me, sir, I have thousands of workers. What will I do with them? You know, these field investigators, they will start, all types of employ them somewhere else. So my feeling is for states like Kerala, Tamil Nadu, Andhra Pradesh, Karnataka, Himachal Pradesh, West Bengal, I have made an analysis of accuracy of CRS. I think they are very good. They are more reliable than SRS. I think Irudaya, because you are traveling a lot, I can't travel. You should tell them to the Babus in Delhi to close SRS in these states and give the money for improving the quality of registration with regard to time of birth and death, cause of death, international classification of birth and disease, these type of things. The other thing is for people with no children, with the sterility problems, I think there is a need to improve. Definitely, we should have facilities, with the see. And I think some of the incentives to doctors can be given, diverted from sterilization to this thing. Some money saved from sterilization can be diverted. But I think government should not play the important role in this. Rather than they should help more private people to do this thing. The other thing which I forgot to tell, the incidence of the NFHS data shows the incidence of induced abortions is going up in southern states. Forget about this. At least to stop that, because that will save the health of women. Stop that, and there are so many induced abortion centers. They are called fertility clinics. They do induced abortion. So I think we should care more about preserving the health and longevity of children and women, and improve the accuracy of data rather than worrying too much whether the fertility can be reversed or not. There is no need to think of that even. We are not in like Japan or Germany or Italy or other countries. We are not in that state of quality of population. Though our GDP has increased, as I told, if you take it as per capita income, we are still a very poor country. No country has got this much of malnutrition, global hunger index. See, we should not be fooled by the macro data. And we are overtaking Britain, we are overtaking Italy, we are overtaking, Germany, Japan, like that. Because they have such a low population, of course we are growing, but economically, but it has not impacted on the health of children. I would stop with this. I think this is a theme to ponder rather than, take the Western, the same Western world, had a Club of Rome and limits to growth. I was a party to discussions. They said, they predicted by 1980, millions will die. Nothing happened. The same Japan is worrying about increasing their population for the last 20 years. Nothing happened, but they are not doing, because they are increasing their expectation of life. They are raising the retirement age. People are still working at 80 there. I think age is just a number. You see, I think if you give good health, good nutrition, I think India has got a good chance, not only to increase expectation of life, but also to increase their productivity and total well-being. Thank you very much. I will stop with this.
Thank you very much, Professor Srinivasan. I think time to celebrate what I call them the silver economy of India, which talks about 140 million. So Srinivasan belonged to that Rome Club of Rome, myself and Professor Nair, 60 group. And with these few words, I would like to request Dr. I thank Professor Nair for rating it, requesting Dr. Sunitha to say the word. Dr. Sunitha, please.
Thanks, sir. It is my honor. It is my privilege and honor to deliver the vote of thanks on behalf of the International Institute of Migration and Development as we conclude today's engaging and thought-provoking webinar. First and foremost, I extend our deepest gratitude to Dr. K. Srinivasan for sharing his invaluable insights and decades of experience. A special thanks to Dr. S. Irudayarajan, Chair of IIMAD, for his visionary leadership and for guiding today's session with such clarity and depth. We are also grateful to Professor P.S. Nair, our founding member, for moderating today's session so effectively. To all our participants, thanks for joining us this morning. I would also like to acknowledge the efforts of IMAD team behind the scenes. Once again, thank you for being part of this important event. Thank you all.
Thank you. Thank you very much.
Thank you.
Thank you. Thank you very much. Thank you.
Thank you. Thank you, Nair. Good to see you again.
Thanks, Professor Rajan. Thank you.
We have done it.